All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. Guess where we are? We're in Manhattan, and we are doing one of my favorite treatments today, liquid rhinoplasty. We already have a beautiful young mom here who just wants a little zhuzh to her nose, meaning we want to make it perfected. She sometimes notices that the bridge is a little low and that the tip isn't as even or as high. So we're just going to use a little bit of filler to kind of just shape the nose. And again, this is a danger zone, you guys, so you have to know who you're going to, and you have to have an injector that knows anatomy in this area, and that's why we're going to be using a cannula technique today. You guys can see my filler is on a cannula. This is a special technique. I'm going to show you guys here. We're going to do in the nasal tip, 1, 2, 3, little pinch. And doesn't feel the best, so she's doing great, although I feel like childbirth is probably worse, so she can handle it. So we're gonna do a little injection technique where we support 1, 2, 3, little breathe out, good. Where we support the tip, and we're gonna lift the tip a little bit. And this is gonna support the septum. This is gonna allow us to get a little lift. And it's nice because this technique, when you smile, it keeps the nose elevated. Doing good. There's numbing inside. This is gonna help support the nose. We are in our Manhattan office, so I'm so excited to have my New York clients. My client here today is New York and LA, which is great. So you guys can see already, if you come look at the side, come from the side profile, you guys can see it's elevated. We're now gonna lift the tip just a little bit, the super tip. So in her eyes. It's always a little bit of pain sensation. We're working on the super tip just a little. Okay, just to get some elevation there so you guys can see. Now I'm going to switch to needle technique. Hold on.
Oh, I can breathe so much better. Oh my gosh.
Oh, no, it actually makes a difference, doesn't it?
It just opens up my septum so I can breathe.
So now we're going to work on the bridge. And on the bridge, I tend to like technique where you just do right on bone, very small blebs. Very little. Just understanding the anatomy.
People are going nuts. They're hitting the like button a lot on this one.
Smash that like button, guys.
Smash the like. And so if you guys take a look from the side, what we're trying to do is elevate this radix area and just even out the bridge. Very little blebs. Keep it even. Then I'm going to go back in with the cannula one more time for a second. Now I've done this many times on the doctor's show. We've done this on videos before to show you guys. It's a very intricate procedure. I'm going to switch sides. It's very important to go
How does
slow.
this improve her breathing? They want to know.
So when you lift the tip and you open this in this passageway, it opens this like a breathe right strip. So it allows her breathing to be a little better.
People are saying great job. They're complimenting our patient and the work.
Yeah, I actually really like how that looks that way. I'm gonna switch with you, Jordan. I'm gonna do one more. I'm gonna go so you can see the rest. I'm gonna use the cannula in a different way now. She shouldn't feel this much. So now we're just gonna even out the bridge by going underneath the nasalis muscle. There we go. This should actually help her breathing.
How much does this procedure cost?
Well, it depends on the syringe of filler, guys.
It depends on what you're using, guys. But if you want to know, we can get you a consult with our lovely coordinators or doctor, and we'll let you know which
There
one's
we
the
go.
best for your
That looks good.
for what you want to get achieved.
And then I
So
go
send us a DM, full name, email, phone number. We're happy to reach out to you.
I'll go right back. Just give her a little more support in the septum there. This will help her breathing and help the tip elevate. I know, it feels weird.
There are times where I feel I can't breathe through my nose. Would this help?
This probably will help.
Probably will help you, but guys, we're going to look at your nose, specifically you. So get a consult with us. Send us a DM, full name, email, phone number. We'll help you out, guys.
And then final bit, and then we'll show her. I think we achieved what she's looking for, which is a little bit of a straighter bridge.
How long does this last for?
This will last at least a year. At least 1 year.
Lasts longer than that for me.
It'll last longer than that for her. All right, so that's the result, Jordan. I want you to kind of pan before we show her. Then we'll give her so you guys can see.
Wow.
Take a look at the straightness here. We left a little bit of a dorsal break because I like her to have that little cute button nose. We want a little elevated and straight. It's still straight, but it's still lifted. You guys can see it here, and then the tip is lifted. Smile as big as you can. She smiles, it doesn't move. It's got a lot of support there. So now it looks much nicer. So let's give her the phone, and we're gonna do an Emer reveal.
All right, you ready?
Okay, I'm ready.
Give her a little
There
gauze.
we go.
All right, take a
Grab
look.
the phone.
Oh
Hold
my
on.
goodness. Oh, you see how it comes in a little bit like this, and I don't have to use contour makeup anymore. Oh my goodness, so
Hold on.
much
Let me
better.
wipe you because right now it's gonna look a little swollen up top,
Yep.
but in a little red.
Remember how it was flat up here before, guys?
Right.
Like there was no height right here.
Right,
Now
and
there
now
is.
you have height, and then look from the side. Smile as big as you can. Look there. Smile. See the support? So it's much thinner and much straighter.
It doesn't feel like
and
it's
more
pulling
lifted.
down. Yep.
Exactly. It's more lifted. All right, so now let's give her the mirror so she can actually see the mirror because I feel like it looks different in the mirror. Let me see when you're away. Let me see. Oh, great.
Looks
Perfect.
so good.
Yeah, it's perfect.
I can actually breathe that alcohol. I smell it.
I know.
Oh my god, I love it, Dr. Emer. Thank you so much. This is a little bulbous because it's swollen.
Yeah,
right?
and because there's a little bit of the tip, so
Yep.
when that goes down, that 20%, it'll
Yep.
go down.
It always does, and then it's really sharp and pointy.
Exactly. So right now it'll look a little bigger here because it's lifted in the super tip and in the septum. In the next 2 weeks, it kind of goes down. Same thing here. This is even a little elevated more than you probably would want it to be in the radix area, but it will go down and it'll be more of an even slope rather than like, a jagged. This will be straighter and this will be straighter. So that is liquid rhinoplasty. I love you. New York and LA, you guys. All right, thanks so much for following. Stay tuned for more. Bye. All right, looks great. I'll see you before
Thank you
go.
so much, Dr.